Hello, my name is Rachel Ambagtsheer. I'm an Associate Professor at Torrens University in Adelaide, based at the Centre for Public Health Equity and Human Flourishing. My broad focus of research interest is on older people's health and wellbeing, specifically as this relates to their interactions and experiences with health and aged care systems. Our research looks at how we can better support older adults in general practice settings. Most people are aware that the global population's ageing rapidly, and that brings some real opportunities for health and aged care systems, but also some challenges. There's been a lot of global attention on this, particularly on screening and assessment for older people. We're halfway through the UN Decade of Healthy Ageing, and there's a lot of encouragement for greater preventive health and health promotion for older adults. So against that backdrop, our team, which is a multidisciplinary group of Australian and international researchers, along with a consumer co-investigator, have been exploring how older adults experience screening for common health conditions in general practice. This has been done through our MRFF-funded impact project, which is now in its final stages. This project's given us really important insights into both how older adults experience screening, what feels supportive, what feels difficult, but more importantly, what they think should be done to improve the process of screening and that process of care and trust within the system. In fact, consumers actually inspired the impact project. I was doing my PhD a few years ago, and it was about how frailty screening should be implemented into general practice. And I had the privilege of working with 240 older people aged 75 plus in that project and spending time with them, interviewing them, etc. And one of the things that came out of their stories was all their experiences, both positive and negative, of screening and assessment in a range of health and aged care settings. So that got me thinking about this in more depth and how we might really surface those voices and experience and perceptions. And that's how the impact project was actually born or came about. A few different approaches to consumer involvement throughout the life of the project, which has been about 4 years. We've had the most amazing consumer co-investigator, Lynn Whiteway, who's been involved right from the beginning of the project, from the earliest stages of conception through grant drafting, submission, and then ultimately when we were successful, Lynn joined our project management team and attended all of the monthly meetings and, assisted us and gave us great input and guidance into the actual implementation of the project. We also had an external project advisory group, which included consumer representation from COTA on that group. So in terms of the project itself, there were 3 phases, and all of which have placed consumers right at the centre of the work. In the first phase, we held a series of citizens' juries in which we brought together about 60 older Australians who were led through this structured process of engaging with evidence and with experts about screening for a range of common health conditions. But in phase 2, we recalled all of the jurors together, so it was about 60 older adults, into this one massive forum, which was a single day, and they were working in small groups and then coming together in larger groups and sharing. And it was a whole day workshop where they were essentially trying to distill what are the general principles across all of the different juries that we participated in. What principles can we elicit here for screening of older adults? So how do we want screening to happen in general practice? So the idea of developing a consumer charter, which is what we did in phase 3, it really emerged out of the discussions we were having with the consumers during the phases of the project. It wasn't actually originally envisaged that we would have a charter in the beginning. And we kind of realised we had an opportunity here to make something that was a bit more generalisable to that universal experience of being screened and assessed for all number of conditions within primary care settings, that there were some things that were kind of integral to that experience that older people, the older adults that we had involved in our project, wanted to enshrine in a charter. And so really the general principles and the charter were completely new aspects of the project that emerged with working with our consumers throughout those early phases. And what they represented for us was a much more impactful way of envisaging how screening might happen or how it should happen in primary care in the future. And so already that charter is being translated into a survey instrument, which is going to be used in a related project. It's a large clinical trial, and it's going to assess how participants feel about being screened in the context of that trial. So it's already, before the project's really even ended, being translated in these new and interesting ways. So it's already influencing for us how we work and collect data across multiple projects. And I think, in fact, it will continue to inspire us in terms of how we move forward in the future, how we design research questions, and really how we're inspired to develop our future research projects. So it will really guide directions for our future work.